as introduced, I'm Myke-Mbata Blessing. Okay, I'll be the chief presenter in this lecture series titled Occurrence Management and Non-Conformance Handling in Clinical Laboratories. You're all welcome. All right, without wasting much of our time, we'll go ahead to find out the objective of this series today. This session is aimed for us to be able to understand the best practices that is needed for incident reporting, documentation, and root cause identification. Also, at the end of this session, we should be able to understand data analytics for trend monitoring and error prevention. We'll also be able to know how to implement corrective actions in order to mitigate laboratory non-conformities. But before we proceed, as it has been our culture, we'll have some questions before we proceed. So I don't know whether that has been made available. So this question would pop up. I'm sure we are all seeing it. Please, we should attempt this question and answer it as soon as possible and submit. Or should I even submit? It's not going to answer. Have you been able to? I think we've spent enough time for that. So can I go ahead, please?
Yeah, please continue.
Okay. Just first. So, as we all know, a laboratory is usually a very busy environment, okay? And despite our attentiveness in the laboratory, even when we have a good management team with good intention to implement quality management system effectively, we still have errors that fall below our expectation. And sometimes some of these errors may not even be detected until it's already too late. And that is why there is a need for an occurrence management system to be put in place in order to deal with these laboratory errors. It's so important because without it, you find out that you won't be able to meet up with results that are not of acceptable standard. Therefore, occurrence management is very important part of 12 quality essentials that we have been discussing since this lecture series started. Okay, therefore, it must be addressed in laboratory quality management. In fact, is an essential part of continual improvement. For a laboratory to continually improve, you must pay attention to occurrence, how you manage errors, events in the laboratory. Okay, therefore, occurrence management was covered in ISO 15189 2025 4.9. Okay, as is stated there, the laboratory shall have a documented procedure to identify and manage non-conformities in any aspect of the quality management system. And this should include pre-examination, examination, or post-examination process. Okay, so when it is determined, I'm quoting it as it is, when it is determined that non-conformities in pre-examination, examination, and post-examination processes could recur, or that there is doubt about the laboratory's compliance with its own procedures, the laboratory shall take action to identify, document, eliminate the causes. Corrective action to be taken shall be determined and documented. You see the keywords there are identify, document, and eliminate and correct. So as we are going on, we'll be able to see how this can be implemented in our laboratory in order to enhance quality. Okay, so before we go ahead, it's important for us to be able to understand certain terminologies. What is occurrence? Occurrence is any event that has a negative impact on an organization, which includes personnel, products, equipment, or the environment. The environment means everything around us, okay, within the laboratory. Okay, then what is non-conforming events, which you always come across in the course of this lecture series today? So it's just something that can happen that shouldn't have happened. Yeah, okay. So non-conformity or non-conformance, okay, it means non-fulfillment of a requirement. Also, it can be also be referred in a layman's term as an accident, okay, or adverse event, error or event, incident, and occurrence, okay? Therefore, what is then occurrence management, which is the main thing we are going to deal on today? Is actually the process by which occurrences, errors, events, or near errors, sometimes we call near misses or even misses, okay? So all these terms, you will be coming across them, okay, are identified and how they can be handled, okay? So what is actually the goal of occurrence management? The goal of an occurrence management program is to correct the errors in either testing or communication that result from an event. What it means is that this error is not just in testing, okay? It could be error in poor communication in the laboratory, okay? So to change the process so that, and also not just correcting, okay? You have to now change the process so that this error will be, the chances of it reoccurring will be very, very low. So how do we do that? Okay, so what are the causes of these laboratory errors? As we have discussed in this, in the several of our lecture series, we have been able to talk about the part of workflow in the laboratory, and which we subdivided into pre-examination, examination itself, and post-examination. It's still the same thing as pre-analytical, analytical, and post-analytical, because I know that all of us here may not be at the same level of knowledge. So if you are hearing pre-analytical, analytical, post-analytical, it's still the same thing as this, okay? Pre-examination, examination, and post-examination. So this workflow is very, and we also have pre-examination, okay? So you find out that there are so many people involved at every stage of this workflow. There are several people, and it includes several processes and procedure, okay? So, and that is why you find out that there are barrage of error that can take place in this whole processes. So this error can emanate from any of the stage, okay? So let's look at some of these errors, okay? We can have some errors from pre-analytical or pre-examination stage, okay? Which we see, okay, sometimes hemolysis, okay, can occur. This can be as a result of using a very narrow bore needle, maybe as a result of shaking vigorously, okay, or even adding, maybe adding little quantity of sample into the additive, okay. So many reasons, okay, can lead to hemolysis. Okay, some can be insufficient quantity, misidentification, okay, and mislabeling of sample, wrong sampling, maybe not following the right procedure, not choosing the right vacutainers, okay, and so on and so forth. And maybe collecting sample in the wrong type of sample, maybe instead of venous arterial blood, collecting venous blood, and so on and so forth. There are so many reasons why error can happen at this stage. We have post-storage, even after collecting the sample. How have this sample been stored? Or was it stored well? Even in transport, was it transported in the right right temperature, okay, and how long was it transported, okay? So poor sample processing, anything can go wrong. Maybe using high speed centrifuge instead of low speed, depending on what you actually want, insufficient mixing, and so on and so forth. This is not exhaustive of all the errors, but these are the possible errors that can occur. Then another one is errors can occur at the analytical stage, which we have like improperly stored or expired reagents, okay, incorrect measures, not following standard operating procedure, poor analytical skill, like having somebody that is an analyst that is not proficient or not even testing the proficiency of an analyst before putting the person on bench, okay? Faulty equipment, reporting results without any form of validation, both primary or secondary validation. Okay, so these are the errors that occur at this stage. We also have post-analytical errors. Okay, at this point, we can have transcription error. Even when you have a good result, somebody can transcribe some wrongly, okay? And then some people may have illegible writing. So maybe another person may read it and may not understand what the person wrote. Untimely reports. If a result is untimely, it cannot be a quality result, because you remember our definition of a quality result. Okay, it must be accurate, it must be timely. Report is useless for the management or for the purpose for which it was requested. Okay, so failure to send reports, sometimes the report may not even be sent at all. Sometimes it will be sent to a wrong location, and before you know, it's already an untimely report, because by the time it gets to where it's desired, it may even be too late. So what are the possible consequences of laboratory error? These consequences cannot be overemphasized, okay? It can lead to delay in treatment, okay? Sometimes, and most times, what we usually witness, we have a lot of waste of resources, waste of the time of the analyst, waste of reagents in the bid to repeat, okay, and waste of delay, okay, in intervention, okay, waste of water, waste of electricity, waste of everything, okay, when you need to repeat, okay, because of one error or another, okay, or even waste of consumables. So, and again, it can lead to insufficient public health action, okay? So you can imagine at the point where COVID-19 was detected and somebody made an error and it was not detected on time. You can just imagine that every little time wasted will delay public health action that would have taken in order to forestall that epidemic, okay? So like communicable disease outbreak, okay? It's just like detecting the first, maybe the first person, like during the Ebola pandemic, sorry. If one is not able to even miss the diagnosis of just one person that comes in, okay, with Ebola. So you can imagine what will happen to the rest of the course. A laboratory error can lead to. It can lead to disease outbreak because of delay in being able to make that diagnosis. We have been underestimating around this environment is the loss of credibility of the laboratory. So many laboratories have lost credibility as a result of this, and you wouldn't know. Okay, your customers will see this and say, look at these people, look at the clinical signs and look at the results. They are not even correlating at all. This is not possible in this. And before you know it, you will lose your customers and they will decide to, and these customers are our best advertisements. So when you lose them, you will also not be advertised. Okay, so it can also lead study discontinuation. You can imagine where one gets a funding, and then you find out that even the results you are getting, you don't understand. You are losing the fund. It may lead to even discontinuation of the study and frustration. Okay, just because the writing is not done. Ultimately, it can lead to death, which will be very sad because these are preventable cause of death. Okay, so what are these occurrence management cycle? Okay, occurrence management cycle include this. It includes detecting occurrences. What it means is that you must put in place measures to be able to detect the presence of these occurrences, okay, before they even occur, not when they have occurred. It must be there checking so that whenever it will be able to alert you, oh, there is an occurrence. So we will look deeply to see how we can detect these occurrences. And then when you have detected, okay, one thing I want you to understand in this occurrence management system is at every point in time, it requires documentation and analysis, systematic analysis of data, because it's those data you got that will help you to be able to know the frequency of occurrence and the occurrence and how it has affected your customers and all that. So it's not just detecting only by using your incident. Maybe a member of your laboratory maybe will just say, we have observed that. No, it's you have to put in place measures that will aid you to get data so that at interval, you analyze those data and know even when you know this occurrence, what is the degree, what's the frequency of this, or it has to be analyzed. It has to be it has to be documented, not just saying it verbally, okay? So then the next step is root cause analysis. You have to analyze the cause of these occurrences. And then before you now be able to know the corrections you will take place, how to correct these occurrences. And this correction is just correction, because there are various actions you must be able to take. You must have a remedial action, which we will discuss later. And then before you now correct, and then you now put in place measures that will ensure that that occurrence does not repeat itself. Okay, so, and this will include monitoring and control. And then above all, at every stage, whatever you are able to get out of this occurrence management cycle should be communicated to the relevant authorities, to the relevant people that will need it, those in your department, in order to tell them, it should be able to influence policy changes, okay, so that it will not recur again. So communication is also very important in this cycle. Okay, so how are occurrences detected? Occurrences are detected, okay, overall in management review, okay, okay, but it's not just management review, but what are the managements reviewing, okay? For occurrence, management involves giving responsibility to somebody, okay? There must be somebody responsible directing, okay, how this whole thing takes place. And that should be either the lab manager or the quality control manager, okay? Either of them, okay? But there must be somebody that is responsible for occurrence management, okay? So there must be management review, but what will you review when there is nothing, okay, on ground? So how can you be able to detect these occurrences or events that doesn't meet the expectation or standard, okay? So the different ways you can meet up with this is by survey, okay? You are putting up a customer satisfaction survey. By that, you should be able to know whether your customers are satisfied. I don't know how many laboratories have been able to do that in Nigeria, okay? And how, if they did it, some may just do it just to have for, you know, maybe doing sake, not following up whatever they got, okay? So monitoring complaints, actively monitoring complaints. And whenever one person is complaints, just know that there are thousands of complaints, especially in this our environment where people don't actually speak their mind. People are afraid to speak their mind. Okay, maybe because they think even if they talk, nobody will listen, okay? So whenever you hear one complaint, just know that there is already that thing that one person is complaining. 100 people have it in mind, but they couldn't complain, okay? So there should be a system, okay, for that complaint. That can be done with a complaint box, okay? That can be done in asking feedback from your customers and so on, and for feedback from your customers and so on and so forth, okay? Internal audits, okay? Some of the audits we have in our country most times is maybe in preparation for accreditation, which is not supposed to be, okay? So internal audits should be done at least monthly, okay? In order to assess whether we are meeting with the standard. Then external audits, okay, which involve proficiency testing, external quality assurance, okay? So information that data is gotten from these assessments is a very useful tool in detecting occurrences. Okay, another one is quality indicators. Remember quality indicators, I think we talked about it in our last week 2 lecture, okay? You remember is a quality can be defined as any information, could be qualitative or quantitative, that measures associated to an event or process or result put under observation that is able to evaluate its changes during the time and to verify achievement of the defined quality goals in order to take the correct decision and choices. I remember when I explained this, I said, okay, you can, like in pre-analytical, I use pre-analytical errors, okay, and how you can be able to set up these quality indicators, like maybe missing data, okay? So how many missing data do you have of all the datas, of all the requests gotten, okay? So percentage missing data can be a quality indicator to tell you how many percentage of this that happens, okay? So you must put that in place at every particular time. There are different quality indicators. It's just something that will indicate that there is something wrong, that will help you to measure, okay? That a measure you must put in place that will tell you that whenever you need that information and you check it, it will tell you whether you are meeting up the expectation or whether you're falling short. Okay, so every laboratory should be seeking for opportunity for improvements by all means. It should be the goal of every laboratory by seeking for complaints, not shutting off complaints, but seeking the complaints, okay? Looking for, how you can improve actively, okay, by so many processes. Then accreditation certification, that is for the laboratories, especially tertiary laboratories that usually go through accreditation certification. The feedback from this accreditation is a very important tool for occurrence because the standard what is actually good in the laboratory, and that will be a good starting point, okay, if one wants to actually improve. So it's a very essential tool for continual improvement if actually a laboratory wants to improve. Okay, so after detecting this, how do we handle the occurrence we were able to get? We have to have a team that must look at this, analyze this, okay, quantitatively or qualitatively. And then when they analyze this, they should be able to now get to rank these occurrences so that they will not the one to put most of their energy, the one that is more cogent, okay, that needs more, need urgent attention, okay? So by so doing, they will be able to pay less attention to the ones that may not have adverse outcome and then pay attention to the ones that is very critical. So they can rank it into severe, okay, just like you're seeing here, high, medium, and then attack, do something about it, depending on the priority. So the priority is now dependent, the priority is based on what? Severity. Okay, so we are now on the root cause analysis. Okay, so what is actually this root cause analysis? I can actually look at root cause analysis like we can have a hypothetical example of a tree that have a very long tap roots. Okay, so when you are looking at a tree or even some grasses that have a very long tap, you won't know. What you will just be looking at is the grass. Let's say that the grass is dying, the tree is dying, but you're not seeing any other thing, okay, apart from the tree that is dying. Okay, the leaves are drying up at the point of the season where they're not supposed to be drying up. Okay, but you're not seeing any other thing, okay? So, but there are other causes underlying, okay? Just like the tap roots, okay? That may be the soil, it may be the pH of the soil, it may be so many other things, nutrients, which you are not even seeing, okay? So this can be likened to root cause analysis in the laboratory, okay? So root cause analysis is a structured investigations that focus on identifying true causes of occurrence, believing that every cause has a deeper reason, not just what you are saying. Okay, so there are tools for assessing the root cause of every error or non-conformance that occurs in the laboratory. Okay, there are different tools that have been used in the past. Okay, but we won't discuss all of them. We will just discuss a few, the ones that is, that are the best ones. Okay, so we have the 5 whys, okay, where we have the 5 whys where you keep asking why. When you get the why, you still ask why is the first what you got. Why is it even happening? What are the possible causes? You keep answering whys up to 5. And it's believed, this method believes that by the time you answer the 5 whys, you must have gotten to the root cause. Okay? Then we have another way. Root cause analysis, you can't, it's just about brainstorming over a cause beyond what you are seeing. That's just what it is. So what other ways can you brainstorm? This is just telling us how can you brainstorm so that you don't miss the main cause of this problem, this non-conformance, this event that happened. Okay, so another way you can brainstorm is what we call fishbone diagram, drawing a fishbone-like diagram, which another name we call it Ishikawa diagram, okay? And then it will be like a structure that will help you to keep brainstorming over so many factors like the 5 M's, man, machine, and all that, okay? So how do man contribute to this? How did the machine contribute to this? How to just that, it will help you. So for each problem, so even after you've talked about machine, you will now look for what are the causes, why did that machine have this problem? Start looking at, so it's just like a guide to help you so that you will be able to brainstorm and lie. So it's just a tool your occurrence management team, okay, will use to investigate, okay, deep into what is actually the cause. That's just what this is all about. Okay, so Pareto analysis, okay, which is also known as 80-20 rule, helps to identify the vital few causes responsible for the majority of effects in a given problem or situation. Here, he believes that it's about only 20% of cause that leads to about or that can contribute to about the 80% of the defects. So even if you've seen so many events, that is, if you're able to, 20% is what contributes to that majority events you are seeing in the laboratory. That's what he believes. Okay, so we have another one called 4-tree analysis, which is a quantitative diagram just used to identify possible system failures. You first of all find the fault, and then you now start using diagrams to just put in the sub-causes. So these are just the possible ones, but there are some that are used widely, okay? These are 5 whys analysis. So it's just a technique used in brainstorming over an event or problem, okay? So it's ideal investigation of specific accidents as opposed to chronic problems, okay? So when something is occurring, it's very good when you have a specific event, okay? Not the one that you have, okay? So it helps in brainstorming technique that identify root causes of accident by asking why events occurred, okay? If it involves selecting one event associated with an accident and asking why this event occurred many times, you keep asking why. Okay, so it produces the most cause of the event, direct cause of the event. But the disadvantage is that it's tedious, and the results are not reproducible because what you write, when you finish writing all the whys, you can't even be able to present it anywhere. Okay, so quite unlike Ishikawa, that is more methodology, the way you draw the diagram, you can present it anywhere and people understand what you did. So you may even just ask only 5 whys and your problem may not even be identified if you stop at 5 whys. So what if the problem will stop at 8 whys before you get, the main cause? So these are so look at how you can apply this root causes, okay? So first why, the second why, you dig deeper. Third why, you continue drilling down to understand deeper reason. Fourth why, revealing underlying system or process related issues. So by the time we believe this method believes that by the time you get to the 5th, you already have reached an actionable root cause and formulate corrective action. Okay, so, but the fishbone diagram, okay, this example of fishbone diagram where you put what is actually the problem, you put it there, okay, as the head of the fish. Are you saying that is at the head of the fish? Okay, so you put in the different broad factors, factors that usually causes errors, okay, in the lab, okay, which are believing that is either from people or from method or from measurement or from machine or from environment or from material. So with that now, you now start brainstorming, okay? All of you now, how can measurements lead to missed deadline? So you start listing them, okay? And when you are doing that, you now be relating it to what is happening in your laboratory that you are there, okay? Could it be because we did not track progress, or is it because there's no short-term goals? Is it because, so when you finish brainstorming on measurement, then you go to method. How has method, okay, method of as administration, okay, or method of running the laboratory, how has it led to this missed deadline? Okay, people missing the deadline, okay? You start looking at, is it there is bureaucracy? Is it because there is poor prioritization? So that's how you keep thinking about, people will be bringing different ideas on that method. When you finish, how has people, okay, people contributed to this missed deadline? Okay, and then everybody, because those that are in the team are part of the lab, so they know what is happening in the lab. So they will start thinking, brainstorming over that. Okay, during that time the secretary was ill and she didn't come. Okay, she couldn't type the memos or wherever. There are so many things. They know what is actually. So you keep writing what caused this deadline, missed deadline. So at the end of the day, you will now pick the vital things, okay, and then be able to work with it. So, we believe that Ishikawa has a very good potential for brainstorming, okay? So it organizes potential courses well, help a team to think through courses they might otherwise miss if they are just asking only for 5 whys. Why? They may even miss some things, okay? So it provides a living document that shows the status of all potential courses and whether they've been proved, disproved. So when you get all these courses, all of you will now start thinking about it. And then at a point you say, oh no, this cannot be the course. You rule that one out. At the end of the day, you now zero on into the possible cause and then profile solutions to some of them, to the most important ones. Okay, so after doing all that, what do you now do? Okay, so you will address the event. Sometimes you may need to stop that event from continuing, okay, and address it immediately, okay, and address even the consequences of that event. And it's always good that we don't get to the point where we are having remedial actions. It's better to prevent these actions so that they will not even come in the first place. Okay, so, but if the event is there, because we are not perfect, so we always have this occurring. So when the event occurs, address the event and its consequences, okay, and always learn from whatever that happened and try to make it possible for it not to happen again. Then another one is to put in a corrective action. By learning from the event, avoiding its recurrence, okay? Then we also should see the potential of the event and plan to avoid it. Put measures in place and make sure that you prevent that from happening, not just correcting and then and just leaving it like that. So you put in measures to monitor, okay, and to control, so that you will be able to detect this whenever it happens again, okay, just like we do with our quality control materials. Okay, so before when you are validating, you see that there is already a problem. Okay, and then you rectify it before it leaves the lab. Okay, but if that measure is not there, you find out that before it would have caused a lot of damage before you will now know that this result is not correct or what. Oh. All right, so in summary, occurrence management process is like this, okay, goes like this. You establish a process to detect problems, okay? This process can be automated, it can be manual, okay? So, but there must be process to detect, okay? And this process must be documented. It's something that whenever you need it, you go back and be able to get the data and then able to. And so when you detect this problem, what next do? You analyze the problem. Not only analyzing as in brainstorming, you analyze by data analysis, okay? So that you'll be able to know whether this problem is worth even wasting energy on, okay? And all that. So, and then you rank them according to their severity. Then another important step, which I know most of us may have in our laboratory, is logging in, having incident forms, okay? And in these incident forms, okay, so it's not just people from outside, okay, knowing there are some events that occur in the laboratory where I think I forgot to talk about it at the point of detecting. So that's what I'm talking about it now, okay? So please, whenever there is an event, whether it's faulty equipment or whatever is it that is the event that occurs, especially in the examination or whatever, not only examination, but pre-analytical, analytical, any event that happens should be documented in the incident. An incident form should be filled, okay? And any action done to remedy that should also be, so that it can also be a means of detecting, okay, problems, these events, so that at the time there will be management review, this incident form will be evaluated, and also it will, so that such things will not happen again. And it's also, the actions taken should also be there, so that if it reoccur, one can take a leaf from what happened that time and also be able to make the correct changes. Okay, so after logging the findings, apart from the incident form, I said we'll also analyze our customer satisfaction. That's our customer survey, and then accreditation reports, EQA reports, internal audit reports. So all those ones should come in handy, okay, and be evaluated depending on what you actually want to detect. You know, you won't allow all of them to come. So anyone is occurrence management process is not allowed to, you know, keep hanging maybe at the end of the year. It should be done almost monthly, or as soon as you are having an event. Monthly, scheduled monthly analysis should be done for all your quality indicators, okay? But if there is any events that occurs, this should be put in place immediately in order to remedy and correct and prevent, okay? So after the log finding and action, you analyze what you have gotten, okay? And then so that you know what you actually look, the magnitude of the problem. Then you investigate, finding the root cause analysis, then take proper action, okay? And monitor, putting in place measures to ensure that this doesn't recur again, okay? So, and then most importantly, provide information to all needing it, okay? This information may be to even the patient, okay? If a patient complains, it's important that when you have put all the measures, you should get back to that patient and reassure that patient that look at this have been discussed in our incident meeting, meeting, okay, and look at the solution profiled, and assure that patient or the customer that next time this will not happen again, and that will restore the confidence of the patient. So what I'm trying to say in essence is not just those in the laboratory that this communication is should be done. No, you should also extend it depending on who is involved in the events that occurred. You should give feedback. If it's a complaint, make sure you give feedback to the person complaining, okay? And that will restore the person's confidence in the processes, okay, taking place in the laboratory. Remember, our goal is to satisfy our customer, okay? So in summary, still detecting and reporting documentation, immediate containment, and root cause analysis. So that is what we need to do. Okay, so the steps we need to take is corrective action. I've said this before, preventive actions, and then evaluating effectiveness of the action we have taken, then communicate to those that are important, okay? And then periodically analyze non-conformances, as we said, so that we'll be able to know, okay, what and identify these occurrences before it affects the quality of our results. Okay, so at a diagnostic laboratory, 5 recurring errors. Look at this case scenario, okay? At a diagnostic laboratory, we have 5 recurring errors that we are identified over a month, according to the internal audit, okay? So we have mislabeled patient samples, delayed. This is an example of how this can look like. Delayed sample transport, incomplete test request forms, okay? Equipment downtime due to poor maintenance, failure to record QC result before releasing patient report. These are very, very, very serious issues, okay? So, okay, so what do we do when this happens? Okay, so all this should be documented. So the incident should be logged in the non-conformance register. Okay, and then root cause analysis should be done. That's what we need to do. Okay, and then corrective and preventive action, okay, form should be filled, and action reviewed during the quality improvement meetings. Whatever action we did should be reviewed in the monthly quality. We should discuss this, okay, in our quality improvement meeting, so that other people will learn. It will also help us to be able to hand whatever skill we have, okay, whatever we were able to get to the to our junior colleague, so that when is their own time to, they will be able to learn from what we have done. Not just after doing, we just write, you know, just write policies and just publish everywhere and tell them you need to do that. They need to be carried along too. Okay, so whatever happens should be discussed. They should be, you know, the laboratory is like a team, okay, where the manager, okay, leads from behind, okay? So you must get your team members involved all through, even if they are not part of the team or the little team, okay? The team you constituted to look at this. Once they will need to come, those that handle this, the event, okay, will come present whatever they did, and they will be criticized, so that another time they may even be able to improve on what they. So it's not something that should be done by manager or the manager should not be criticized. No, you have to present this, and people will look into what you did, even criticize. In fact, sometimes even what you did may even not be accepted before it becomes a policy. This is very important, so that everybody will feel that they own whatever okay, documents that comes out of whatever they did. And when they own these documents, they will be able to effectively apply this, okay? So what was the actions taken, okay? So they tried to review all of sample collection SOPs across all departments. They now had to integrate barcode labeling system, okay? That was proposed. And they also proposed monthly audits to monitor compliance and error trends. Okay, so these are some of the things that they did as a result of this, okay? So what are other things they did? Okay, immediate remedial action, the sample testing was halted. Okay, I didn't mention that the clinicians was notified. A fresh sample was requested from the correct patient. Then what did they do as corrective and preventive measures? A refresher training on patient ID and labeling was proposed. The implementation of a two-person verification system, okay? Then color-coded patient ID wristbands was introduced in order to ensure that there won't be misidentification. Then phlebotomy checklist updated to include a final ID confirmation step. So these are all the things done in order to ensure that this event was taken care of. So we have some discussion questions here. So what other immediate risks did this error pose? Okay. Could the incident have gone undetected? What would have been the consequences? So what we're asking here is, you saw all the problems we have: mislabeled patient samples, delayed sample transport, incomplete test request forms, equipment downtime due to, these are the problems we discussed, okay? So, and look at the immediate remedial actions we took, corrective preventive measures, okay? Then documentation that we did, and then ongoing improvement strategies in order to prevent it from recurring. So we are now asking, okay, what other immediate risks did this error pose? I don't know whether somebody can answer that. Okay, maybe we'll take that home, since we are going to send this slide to each and every one of us. We'll try to also brainstorm on that. Could the incident have gone undetected? Yeah, of course. If we are not checking, if they are not proactive, okay, the incidents could have gone undetected. And when the incident is undetected, okay, you find out that patient's results, one patient result will be used to treat the other patients. You know the consequences of what that could mean, okay? And it could lead to delay in treatment, it can lead to death and others. Are there parallels in your lab? What system do you have to catch such errors? These are take home what you need to think about your lab. You need to personalize what we have done today and then look at your lab, okay? And in the how do you detect events in your lab? So how can technology support better error prevention? You know, we have talked about automation, okay? Automation help in reducing man-made error, okay? It helps in reducing man-made error, okay? That doesn't mean that automation is not prone to error, but it reduces it to a significant extent. Okay, so automating our lab will help reduce this error. And automating our lab will help us to be able to detect these errors faster, okay? And even when the time you will take to start going through your datas one after the other in order for you to be able to detect this error. If you have laboratory information system, he will be able to generate this for you. Okay, you just get these informations. What you need is to analyze them, error prevention. But this is a take-home. Think about it. Okay, so in summary, the laboratory should employ an active process for occurrence management and take a positive approach. The laboratory should try to detect problems early and take immediate remedial and corrective action. It should seek opportunities to identify potential error, thus preventing its occurrence. It should keep good records of all problems, investigations, and actions taken. Is laboratories not implementing a quality management system guarantees undetected error. Therefore, laboratories should try to detect problems early and take immediate remedial and corrective action. Seek opportunities to identify potential error, thus preventing its occurrence. Keep good records of all the problems, investigation, and actions taken. You know, as I told you, there should be an incident form where all these problems should be recorded. What investigations did the investigations done and actions taken, it should be recorded so that all that this information can be retrieved when is necessary. It can also be able to help us to solve future problems. So the food for thought, the difference between a quality managed laboratory and those with no system in place is that the quality laboratory detects the problem, investigates, and takes action. Thank you very much. The next week presentation, which is week 18, will be handled by Dr. Mba Izuchukwu. And the topic is leveraging digital transformation and information management in QMS. Okay, so below is the objective. Okay, so any question, please? I think we should give room for question.
Yes, thank you very much, Dr. Mbata, for the very, very sound presentation. The floor is open for questions and any reactions, whichever one that you have from the participants. So you may please unmute yourself and ask your question. Alternatively, I'll be keeping an eye on the chat box, so you can also ask your question by dropping a message in the chat, and I'll read it out for her to attend to. All right, so please go ahead with your questions. Dolapo Moses Ola Yuola says, thank you so much for the insightful presentation. Okay, thank you very much for the feedback. Are there any questions? It appears our participant turnout for today is low. I presume a number of people think because of the public holiday, the Easter break and all that, we will not be having this session. But the schedule that was shared from the outset, we scheduled 28th of April for this presentation. Sorry, 21st of April for this presentation, mindful of the fact that it is an Easter holiday. So, let's just say it didn't think of it that way. We're still waiting for any questions from anybody. Okay, in the absence of any questions, is there one in the chat room? Onichi Lillian says, very insightful. Thank you very much for the feedback. All right, in the absence of any questions, we want to thank each and every one of you that joined us today.
Sorry, good evening.
Hello, good evening. You're welcome.
This is Lillian.
Okay, please go ahead.
My question is that in the case of this mislabeling and misdiagnosis or so, like using someone's sample for someone else's sample. What if it goes undetected? Like that means the problem is there, like it was not fixed. The patient was given a wrong result, and probably if the result is pathologic, the person will go on being treated of what he doesn't have. How can a lab trace such misconception? How can it be handled? Like when the result must have gone out there, and then maybe someone else came back to check and everything is normal when he's not normal. So what do we do? Do we call back the patient, the first one that was giving the wrong result, or how do we manage that kind of case?
Okay, thank you for that question. It's a very good one. Okay, and is not this question is should be in everybody's mind because it's an event that occur very commonly in our laboratory. Okay, so I have different ways of answering this question. Okay, so one of it is to prevent this from occurring. This shouldn't be occurring in our lab. And how can we prevent that? Is by having, remember in our lecture we had in lecture series of week 2, okay? We are supposed to use 2 identifiers, okay? 2 identifiers, not less than 2 identifiers, okay? Not just because one person may have, 2 people can have the same name, okay? 2 people can have the same name. Okay, so you must have more than 2 identifiers so that you will not be able. Then another one is also to have this rechecked. Somebody can recheck. I'm talking of a laboratory, the common kind of laboratory we have in Nigeria, where most everything is manual. Okay, so another thing you can do um is to check also the record because the person that is coming in is not coming in just to the lab. Most of the time they come from the hospital, so they have a record already. Okay, so that record should come with the patient. So it's not at that time you're asking, what is your name? What is this one? What is that one? You understand? Sometimes you may be very tired. Okay, so what you will be doing is to cross-check the information already before you and what the hospital have also. So that can be how you can delta check. Then another way to delta check is another person may cross-check what you have done. It won't be harmful if somebody else come to the same patient you have sampled, you ask, what is your name? You check the form the person is holding, the name, and you, what is your name? You know, that's another way to do it. Then the best way to do it is what? Automation. Use of barcoding. With that, except the barcode failed, okay? This will be very reduced to the barest minimum because you don't even need to check because that with that barcode mechanism, you won't have problem of mislabeling. Thank you very much. I hope you followed me so far. I hope I made sense.
Yes, you did, but I'm still like I'm still not convinced. Like I'm sorry, you've not really answered my question. My question is a case where the result has been given out to the wrong person. And
okay,
then
all
that
right.
result,
Okay.
yes.
That means I've not completed the question. I've just talked about how you can prevent
How
it.
we can
Okay,
prevent
but so when these have already happened, okay, so what do? Okay,
More
you
like what remedial
remember that
actions can be taken.
if you don't put in place measures, you will not even find out. That's just the truth. You understand? If you don't put in place, you will not even find out. So when you find out, what will you now do is to call back the patient. And what it means that you should have the patient's address. So you should be able to call the patient to come. You should be able to have somebody that can talk to the patient, reassure the patient, and also resample the patient, and make sure that the patient is calm while you are talking to the patient about the mistake. You admit that mistake is from you, and then you have to remedy the action. And if the patient needs to report, fine. Okay, the patient can report. You tell the person where to report. Okay, and such things should not end there. It should be discussed. In an incidence form should be filled immediately. Okay, the action taken at that time should be also filled in the incident form, and that incident form should be submitted, okay, to the team, okay, the quality management team, okay, or to the head of the to the what's it called, to the lab manager. The lab manager will now forward it to the quality management team, where they will now dig deep into the cause. Okay, because what you did is just to call the patient. Okay, we are sorry that we had to inconvenience you. We need to do this test again because we made a mistake and all that. This will not happen again and all that. Okay, so when you've done that, you will need to send that information to the team, to the team. So they are the ones to now do the root cause analysis. So when they do that, they will now profile the cause. Why did this thing happen? And when they find out the cause, okay, so they will take a corrective action and then put a step, which, just like I said, okay, a preventive step, measures that will make this not reoccur again. Just like say, maybe they will now put in somebody to be double checking what the other person, depending on where they found the problem. Okay, so these are the possible things they can do to ensure that it will not happen. I hope I've made a fair attempt to answer your question.
Yeah,
Yes,
maybe
ma'am. Yes, ma'am.
I should chip in something here. Hello.
Okay, okay.
All right, I should chip in something here. Sometimes when an occurrence has happened, the immediate thing or the right thing to do is to attempt to remedy the situation. And we know remedials are not entirely satisfactory. It's better issues were avoided than being remedied. So by remedying issues, you try to minimize or reduce the consequences of that occurrence. And as good as that may sound, there are situations where even our remedial actions will not be enough. In fact, I'm going to give a context to this, an example. Okay, I've heard of a particular situation in a laboratory where samples were sent for two different people, breast lesions. Biopsy samples were sent to the laboratory for two different patients. Okay, and it turned out that one of them was a non-malignant lesion and the other was malignant. And erroneously, the samples were switched between patient A and patient B. So at the end of the day, the report on the tissues presented to the lab were correct, but it was not for the correct patient. Now, what happened was that the sample went for the wrong patient. The patient with the malignant lesion received a sample suggesting that the lesion was benign and they could do a lumpectomy and so on and so forth. While the person who had a benign lesion actually received a pathology result suggesting that the lesion was malignant. And this woman was subjected to mastectomy and chemotherapy. Now, it was when the tissue from the mastectomy was sent for a second review that it came back being benign. Now, at that point, this woman has already been exposed to chemotherapy. She had already had a mastectomy, and then before the laboratory was realizing the mistake that was made. Now, one of the first things that happened was the laboratory taking responsibility they acknowledged the fact that they had made a mistake in terms of sample management. They called and spoke with the patients, reassured them and all that. But it was not enough. So this patient decided to pursue redress in court. You understand? And this is where indemnity comes in, because when such a thing happens, it has a tendency to actually close down that laboratory. Because the woman I heard was demanding for 500 million naira in damages, for the mistake that was made. So, as in as much as remedial actions can be taken, so sometimes they may not just be enough. All right, and that emphasizes on the need for risk-based approach in the laboratory. Anything that has the potential of resulting in an occurrence should be treated as an occurrence and dealt with squarely, so as measures will be put in place to prevent such from happening. So, in response to the question from Onishi Lillian, yeah, if the result is already out there, the laboratory has to first of all be honest, admit its mistakes, and look forward to ways of, you know, palliating the problem or remedying the problem if possible as much as it can. And that would just be it. Thank you very much. I hope that's all the explanations so far is quite clear to you, Onishi, Lillian.
Yes, sir. Yes, sir. Thank you so
All
much.
right. Okay.
Yeah.
All right. Do we have any other questions? Do we have any other questions? Somebody speaking there.
Thank you, Dr. Bruno. Thank you for the way you really explained with example the action and the consequences of not finding on time, or rather not the consequences that could occur despite a remedial action. I mean, using examples, so it's just mine is not a suggestion. I think like hello? Hello?
Yeah, we can hear you.
Hello?
We can hear you.
Oh, sorry, it was high. Okay. All right. Thank you so much. I just want to suggest, because I could see that the slides are quite voluminous. Yes, we can always go back to listen to them, over and over again. But if our esteemed resource person can give us examples, as she's explaining, she gives us examples. Like in fact, having explained that, to be honest with you, I never in my entire life forget the thing that has to do with real action, corrective action and sensitive action. In fact, the emphasis should actually be on these three things when it comes to root cause analysis for me. So I think give examples we go way to setting uh, the point she's trying to pass across. That's just a suggestion. Thank you so much, Ma. Thank you, Dr. Bruno. Thank you,
All
everyone.
right. Okay, thank you very much for the feedback. We are going to take note of that and incorporate that in our subsequent meetings. I believe some of our resource persons for the next presentations are also online and have heard your suggestions and recommendations. So going forward, we are going to do all we can to introduce that into our presentation as much as possible so as to be more relatable, to have relatable examples that will drive home the point within our presentations. So thank you very much, Kenechi Kalu, for that suggestion and input. We appreciate it. Thank you very much. Do we have any
Good
other
evening.
feedbacks or questions?
Good evening. I just asked the key difference between remedial action and corrective action. Are they the same or there is a major difference?
Okay. Dr. Mbata, are you there?
Yeah, I'm here.
Loretta Etafo is asking if there is a difference between corrective actions and remedial actions.
Remedial action is usually what you do when there is already a consequence. Okay, so what do? You handle the consequence of the actions to remedy, to make
Okay.
sure that the consequences um are not felt, okay, that much, alleviate the
Okay.
consequence, okay? Then you now correct that thing that was not in place that caused that problem, you correct it, okay?
All
So,
right. Thank you, Mark. I understand now.
Okay, thank you very much. That was very straightforward explanation. Um, I don't know if we have any other questions. We'll probably call it a day. Uh, okay. So I want to use this medium to thank each and every one of you that participated in today's engagement in our webinar series on this topic on occurrence management and non-conformance handling. We hope that the insights and the strategies that have been shared in today's discussion will inspire positive changes in your laboratories and your practical and your practices. Okay? So let's stay tuned for our upcoming sessions where we'll continue to explore critical aspects of laboratory quality management. Together, we will all strive for excellence in laboratory quality and contribute to better healthcare outcomes. Have a great day. We look forward to connecting with you again, same time next week. Have a nice day. Thank you all. Bye.